Thank you, Mr. President. House Bill 4098 creates a new fund and board to direct Oregon's share of settlement revenue from the class action lawsuit with several opioid distributors. The measure establishes the Opioid Settlement Prevention, Treatment, and Recovery Board within the Oregon Health Authority to determine allocations of settlement revenue for statewide and regional programs that address opioid use and disorder and other behavioral health issues. The allocations made by the board must be consistent with the settlement agreements. A portion of the settlement fund must support a system to collect and publish data about the efficacy and availability of treatment and recovery services in this state. The measure also expands the number of agencies defined as participating state agency that enters into agreements with support of the work of the Alcohol and Drug Policy Commission. These agencies are required to support the Commission on implementing its treatment and recovery plan for the state. The estimated fiscal impact is $625,733, other funds, and 5 positions in the 21-23 for OHA to support the new Opioid Settlement Board and related work. The fiscal impact related to allocations from the settlement fund will be determined by the new board once it's formed. I worked on the latter part of this bill with Representatives Tana Sanchez and Dr. Richardson from the Alcohol Drug Policy Commission from the last session. As a member of the ADPC for the last 5 years, I know that expanding the list of agencies that work with the ADPC is crucial to the work and implementation of their strategic plan. We need the information to process and outcome measures in order to help move Oregon in a positive direction and away from our standing as number 2 in the nation in addiction rates and last in providing treatment. We are seeing the effects from the pandemic with the rising rates of drug and alcohol use. This is a stark reality that we need to address as it affects our economy and our healthcare system and costs lives and livelihoods, not just from those suffering from addiction, but has a negative ripple effect on family, friends, and in our community. I know this from my own personal family issues deeply impacted by the disease of addiction. We must do better. Oregonians deserve better. The Joint Committee on Ways and Means recommends the approval House Bill 4098 as amended. Colleagues, we cannot wait another session to pass this bill. Too many lives are depending on us. I urge your support.